Hello, dear friends. I'm here with you, Sofya Dorinskaya, President of the International Bureau for Human Rights in Mental Health and head of the Sofya Dorinskaya Center for Medical Information. Today, I want to tell you about some very interesting cases that have started coming into the Sofya Dorinskaya Center for Medical Information. But as interesting as they are just as tragic. 3 women have already contacted us with stories that are almost identical. Here are their stories. A woman wanted to lose weight. And for this purpose, to get rid of swelling, this person for a very long time, about a year, regularly took diuretics such as furosemide. And so in this way, she kept losing weight, getting rid of the swelling. And after about a year, an acute psychosis began. It started with delusional symptoms, with hallucinatory symptoms. The person was disoriented. And all these women ended up being taken by their relatives to a psychiatric hospital. There they were treated with antipsychotics which had absolutely no effect on them. And after some time, they were given electroshock therapy. One woman underwent 10 sessions. Another woman, as far as I remember, almost 32 sessions of electroshock therapy. The situation didn't improve at all. In fact, everything just kept getting worse. Naturally, people lose their memory and their work skills from electroshock therapy. Their mental state gets even worse. And so they came to us with this kind of history. And I'll tell you even more. Every time someone comes to us and says that they have so-called resistance or insensitivity to psychotropic drugs, to neuroleptics, I immediately ask, have you used diuretics like furosemide for some period of time? And in this way, I start to clarify these 3 stories. One of the first stories, so to speak, I uncovered by accident, and the other 2 I specifically investigated. So let's talk about this. I hope this video will help women who also... It's summertime, right? Some people have vacations coming up, so to speak. Some are about to go, and others still have it ahead of them. So let me tell you what this system in the body is and how to make sure that in your pursuit of a beautiful body, you don't end up in a mental hospital, or even worse, on an electroshock therapy table. So let's figure this out. Indeed, there is a stagnation of a certain fluid in the body. And it's precisely when trying to solve this problem that women start taking diuretics. But where does this tissue stagnation, this fluid retention in the tissues come from? Proteins, when they enter the bloodstream in sufficient amounts, help retain water in the bloodstream. As soon as the amount of proteins in the bloodstream, albumins and others, decreases, the body redistributes water, sending it into the tissues. And that's how these very stagnant, swollen tissues form. Congestive phenomena in the tissues, edematous tissues. A person becomes bloated, feels heavy, feels weighed down. Even though if you look at this person's diet, they're not eating much, they're on a diet, constantly eating salads, restricting themselves in everything, yet the body still swells up. Let me remind you of the wartime expression, swelling from hunger. This is exactly that mechanism. Some people swell up, some people wither away, it doesn't matter. Right now we're talking about the mechanism where a person becomes bloated from hunger. And it's very easy to check if you're on a diet, if you're restricting your food intake and yet your weight isn't going down, you feel that your body is heavy, you feel like you're swelling from the inside. This means you have the first signs of this situation when, to put it bluntly, you're swelling from hunger. Another thing that can potentially occur if a person is not eating an adequate amount of food is that the total amount of protein in their daily diet begins to drop to lower levels. Next is ascites, which is the accumulation and release of fluid into the abdominal cavity, causing the abdomen to become enlarged and to protrude. Following this stage, As a direct result of a chronic lack of essential nutrients, a significant loss of normal function in the intestinal cells occurs. They are completely incapable of performing what is known as peristalsis, or functioning in a proper manner and at the correct speed to efficiently transport food through the digestive tract. As a result, food and gases that are produced during its digestion stagnate in the intestines, which leads to bloating of the intestines. This is why there is a strong sensation of flatulence and there is rumbling in the intestines. Next, when a person is undernourished, when they do not get enough protein, the amount of enzymes that are supposed to break down the food they consume decreases. Enzymes are also proteins. And as a result, food begins to rot in the gastrointestinal tract. In addition, as I mentioned, there is dysfunction of the intestinal cells themselves. Dysfunction means impaired function, and as a result, food begins to rot in the intestines, since food is rotting in the intestines. Bacteria multiply, and the immune system is, again, made up of proteins. There are two parts to the immune system. One consists of proteins and the other consists of cells. But in order for the body to produce immune system cells, it also needs proteins. Consequently, the immune system suffers greatly. And it turns out that, roughly speaking, a person's food mass is rotting in the intestines, and the body can no longer cope with the toxins that are released and the bacteria that multiply in the intestines. And so the lack of proteins, the lack of quality, proper nutrition, and sticking to these diets. That is why people who deprive themselves of quality food, of real high-quality protein food, and just eat salads and apples around the clock with buckwheat are actually harming their health. And this does not lead them to the desired result. And we must not forget that there is also such a term as starvation dementia. From the very fact that a person is undernourished, they can lose their mind. And what happens then when a person has these kinds of problems? Precisely as a result of undernourishment, they start using diuretics, water pills. I don't understand why everyone rushes to take furosemide, even though furosemide, this is a very serious diuretic, which when I was studying, and as I understand it, it had just appeared perhaps, though I don't know exactly when it came out, but furosemide was considered a resuscitation diuretic. It's a resuscitation drug. Furosemide can only be used for a very short period of time. It really is a very powerful diuretic, a very strong water pill. But what is its potency based on? It is based on a very serious alteration of the body's mineral balance. And when, for example, in a hospital setting, a person is given furosemide, it is always done under monitoring of the blood's mineral composition. They run tests. If furosemide is administered via IV, it is always given with saline solution. It is never given with glucose, for example, precisely because furosemide affects the mineral composition of the blood. And you can actually just send a person to their grave. And when you having that very state of swelling due to nutritional deficiencies, you start taking diuretics, this furosemide diuretic, which severely disrupts and damages the mineral balance of your body. Next comes psychoses, because psychoses develop. When sodium metabolism is disrupted, when potassium metabolism is disrupted, when magnesium metabolism is disrupted. And that's exactly what we see. And why do these people develop resistance to neuroleptics? Because all psychoactive substances have an effect. Their mechanism of action is such that they are aimed at creating nutrient deficiencies. In other words, they only work on people who have these minerals and vitamins. But if a person develops psychosis as a result of already severe mineral deficiencies, neuroleptics will not work on them. And psychiatrists, without taking a medical history, without finding out the cause of the psychosis, which in this case was a woman taking furosemide for a year, are already putting this patient on the electroshock table. and they simply start destroying brain tissue. This is just the height of madness and utter incompetence. This is already such a complex problem. But what needs to be done here? Let's go back to the beginning. If you find yourself in a situation where you really feel your body is getting heavier, your body is swelling up, if you constantly feel bloated, this is a sign that you are eating incorrectly, and your entire diet needs to be fundamentally changed and reviewed, specifically in terms of the amount of protein. There is one more little nuance. You might start eating a sufficient amount of protein, but it won't be absorbed. And proteins are not absorbed when there is a deficiency of vitamins, minerals, and trace elements. And most likely, the main reason for your excess weight, the main reason that has already led you to this diet, that you're restricting yourself in food. Initially, as a person, you had nutrient deficiencies that developed. And I have already said several times, and I will repeat, that if a person has deficiencies, then simply taking the recommended vitamins that are sold in pharmacies will not eliminate them. Those are maintenance supplements for people who do not have deficiencies. But if you do have deficiencies, then it's not that simple. You go to the pharmacy, buy whatever comes to mind. Deficiencies are not eliminated that way. And if a person initially has deficiencies in vitamins, minerals, and trace elements, as they gradually accumulate, they lead to poor protein absorption. All of this leads to developing edema, redistribution of fluids in the body, disruption of the gastrointestinal tract, and a weakened immune system. That is why, if you've noticed, overweight people or those who have started to gain weight often begin to have skin problems. And if you are a woman and have looked at various forums, whenever skin problems, acne, and so on begin, everyone says, treat your gut. All these skin problems come from the gut. So how do they come from the gut? Yes, exactly from there. If a person does not absorb proteins, their immune system falls apart. So if we go back to the foundation of this pyramid, right to the entry point for resolving the situation, that is. The entry point, it is the elimination of deficiencies in nutrients, vitamins, minerals, and trace elements that allow proteins from your food to be absorbed. And then, the physical body itself gradually begins the process of rebuilding and restoring the damaged functions. It starts to systematically address the various underlying problems it has on its own. In this way, you can regain your health, slimness, and beauty. If you, and of course you should, go on to the gym, your workouts will be effective because you can only build muscle through training, obviously, but only when the body receives an adequate amount of nutrition. And all these beauty procedures like body wraps, which are aimed at removing excess water from the tissues, will be effective for one simple reason. You will eliminate the root cause of stagnation in your body. Therefore, I hope this video, it will help women stop tormenting their bodies by using diuretics and diuretic teas. In the worst cases, these are already diuretic medications. Honestly, for me, this was a revelation. I understand this mechanism and that such things are happening now. I hope this will protect you from such consequences from these diets, which, to be honest, are unlikely to be reversible, because after electroshock you have to understand this is intentional destruction of brain tissue with electricity, and this is intentional. It's just a direct path to the creation of so-called, there are already voids in the brain when cells are destroyed, and so-called cysts form there. And this means loss of working ability, loss of intellectual functions, destruction of the endocrine system. In general, there's a whole range of problems. But you shouldn't let things get to such truly terrible situations. If you feel that you need this, please address nutrient deficiencies, adjust your diet, and help your body, because the human body is not stupid, it's not foolish. The body does not like to be heavy. The body is, after all, an instrument. The body has been with humans for thousands of years, and it is a biological machine that is perfectly capable of regulating itself. If something is wrong, you need to look for the reason why it's wrong, and not just take some substances that will lead a person into problems from which it will be very difficult to get out. I hope this video will help those who have decided to go down this path. And I really ask you, if your relatives, as you know, are doing such things, show them this video. And if you know that someone you know, to put it bluntly, has lost their mind, get in touch with us. We will try to help. And at the very least, no electroshocks. No electroshocks. It is possible to help a person, even in an emergency situation. Let's communicate. Thank you for your attention. All the best.